transition toward demand of private hospital. So almost 70% of the medical specialists said that they had received job offers from private hospitals. So based on Human Resource for Health Country profile, Malaysia stated that government doctor who are above age of 40 are likely to turn over. After graduate, the doctor will do housemanship at the public hospital. So once they obtain full registration with the MMC, the doctor are needed to serve in the public sector for further of 2 years. So but after this period, the doctor are allowed to move to the private sector if they want. So this is where the issue has arisen, where the doctors who have no experience serve in the public sector, and after they gaining experience, they move to the private sector after the age of 40. So this make a senior doctor who remain in the public sector face a huge burden, because every year they need to training and supervise the large of number of junior doctors who join the service. So the reason of physician turnover is because of rising cost of living. So a study from Malaysian Medical stated that the dissatisfaction towards salary, allowance and benefit affect job satisfaction among doctors in Malaysian public hospital, because doctor salary in the public sector are lower than those who are working in private hospitals.
Based on the article, the issue of gender inequity of nurses is one of the issues related to gender in healthcare workforce is the lack of male nurses in Malaysia. In our country, Malaysia, the nursing profession has a huge gender imbalance. In 2013, only 1.8% of male were identified as nurses. The reason why the number of male nurses is low compared to females is because of the stereotypes of nursing. Malaysia has a shortage of male entering the nursing programs such as diploma or bachelor degree. If the number of students who apply for these courses is still low, how can Malaysia produce male nurses to fulfill the market demand? Male nurses are needed especially at critical care such as the trauma department, operation theatre and intensive care unit.
How to avoid this issue occur? Ministry of Health can do more programs that expose the benefits of male nurses in the healthcare industry to increase the knowledge and reduce perception of society about male in the nurse field. Second, spread more information that Malaysia really needs more male nurses to encourage people to choose this career.
Healthcare workforce in Malaysia can be divided into two categories, which are public sector and private sector. According to the Ministry of Health, the majority of doctors, nurses and pharmacists are working in the public sector. In 2013, the ratio for doctors in the public sector to the private sector was 3:1, while the ratio for nurses in the public-private sector is 2.3:1. The reason why the number of healthcare workers is higher in the public sector is because of the large numbers of fresh graduates entering the workforce during 2008 to 2011. The issue of the public and private sector among the healthcare workforce is interrelated to the increasing number of medical graduates. According to Malaysian Medics International (MMI), around 33 medical institutions produce 3,000 doctors every year, and another 3,000 doctors came from overseas after completing their studies. As we know, before new graduates are allowed to work with private hospitals, they have to undergo an internship in the public sector for 2 years. To simplify, with the highest number of medical graduates in a year can cause delay for graduates to get their internship placings, as they need to wait up to 6 months or even a year. It is due to a surplus of doctors but limited intake for internship programs by the public sector.
The imbalance of health workers can lead to significant difference in health outcomes between rural and urban populations. Urban areas are more attractive to healthcare practitioners because of their comparative socio-economic, cultures, and technological advantage. Large metropolitan centers provide more opportunities for careers and educational advancements, higher employment prospects of health professionals and their families, easier access to private practice, lifestyle-related service and amenities, and greater access to educational opportunities of their children. Furthermore, the low status frequently bestowed on those employed in rural and remote areas further leads to the desire of health professionals to settle in urban areas, where more prominent roles are viewed. In urban areas, paradoxically accessed numbers of health professionals often facilitate outward brain drain instead of encouraging workers' relocation to rural areas as professionals continue to live abroad of job opportunities.
In conclusion, in every issue that arises, there must be a solution. But it may be hard and difficult to implement new changes to our healthcare field. We need some administrative adjustments and also some increase the healthcare budget because our healthcare is still underfunded. We hope in the future our healthcare can be improved and healthcare in Malaysia can be comparable with other developed countries. Thank you. Have a good day.